Hello and welcome everyone to another online info session at the American College of Traditional Chinese Medicine. My name is Hannah Strack and I am the admissions counselor here at ACTCM, and I'm joined today by Dr. Carla Wilson, and she has a lot to say about evidence-informed practice and research at ACTCM. We'll be sharing a PowerPoint. So why don't you introduce yourself, Carla, and tell us a little bit about yourself.
Yes, I am happy to be here. Hannah, thanks so much for arranging this. And when Hannah asked me what I might want to talk about, I had to think about that a little bit because it's kind of what is of interest to our communities of interest, whether folks be faculty, students, potential students, folks who are practitioners out in the world. What's sort of a common theme that we might explore here for the next half an hour that would be of interest and perhaps value to a variety of different folks. So I chose something that's most precious to me at this point in my career and my 30-plus years in the field of Chinese medicine, and that is evidence-based acupuncture, evidence-informed practice, and how is it that we can bring research into develop a culture of research and bring research into discussion and thinking in a variety of different ways. And so today I'll be talking a bit about that, and also then toward the end of the presentation I'll be talking about my most current research project that brought together California Institute of Integral Studies program and ACTCM program to do sort of a combined mixed methods approach to acupuncture for elders and affecting the propensity for fall. So we'll be talking some about that. So Hannah, any questions for me before we just jump in?
No, we can definitely jump right on in.
All
right, I'll leave it up to Carla.
Okay, so happy post-Thanksgiving, everybody. And today, the discussion is going to be around evidence-informed research, partly what's happening at ACTCM at CIIS. It looks like we lost a little bit of the title there, but we'll be talking about that and sort of on-the-ground approaches to how to begin to embrace research, whether you're at a college or out in your own practice, or just considering how to approach asking questions and looking at ways to investigate specifically acupuncture and perhaps bringing in other modalities as well. So here's some of the things that we'll actually talk about. We're going to talk about evidence-based acupuncture, try to demystify that and make it sort of a more of a usable phrase and put some thinking into that together. We're going to talk about how ACTCM students or potential ACTCM students might become involved in research, how to think about that and how to think about how that might fit into interest of those who are considering Chinese medicine as a potential career, or maybe even as a second career, approaching becoming a practitioner down the line. And then we're going to talk about some current research that's taking place at ACTCM. And then we'll have a time for questions towards the end. Okay, so I just want to start with a basic question like, what the heck is evidence-informed what? Like, what does that term mean? I mean, it gets thrown around kind of like integrative medicine gets thrown around. It gets applied to different types of topics, but I want to talk a little bit about some of the principles around it. And that means that evidence-informed practice is about ensuring that health practice is the best by research and best at research and information available. So that means we're taking a look at what research is going on out there and what's taking place in the world of inquiry into specific practices or therapies. It takes a look at good evidence that identifies potential benefits, harms, and costs of an intervention. So it really takes the whole, looking at all angles of what evidence is out there. So it means being able to evaluate research or what's out there. And then it's about that it may be also of a qualitative or quantitative nature. Now, my interest is really more about mixed methods. I really, as a Chinese medicine practitioner of 30-something years, part of what is most intriguing to me about research at this point is how do we bring the lived experience of our patients or our populations that we're bringing acupuncture to, and have that be a part of the discussion and the development of structure and approaches to research. How do we design research that is inclusive of the patients that we're serving and the populations that are receiving acupuncture and the inclusiveness of Chinese medicine, and have that be a part of the research that we're designed, that we develop. And then in the health promotion context, we want to look at evidence-informed practice of how it comes from resources that include what we now have available on the people that we're working with, and that is scientific journals and publications, evaluative reports, and also population health statistics. And it helps us to develop a story, and whether it's based on locally collected data, nationally, or even global, it helps us to better understand the direction for our research design, as well as thinking in terms of what is the appropriateness of developing acupuncture studies or acupuncture inquiry that meet some of the needs of this different context. So I'm going to talk about types of evidence, and evidence-informed practice, and we'll just start to call it EIP, is broad in scope, and it considers mainly many types of information when making health decisions. It recognizes that there's no single type of evidence that represents a total truth. That means that truth moves around depending on who it is, the patient group that you're serving. It means different cultures, and so truth is a relative concept, and it's part of why we look at the research that's already out there to take a look at what is most useful for the populations that we're serving based on their backgrounds or cultures and such. So it's about the patient's presentation. It's about finding some research, and it's about, most important, is experience, both the clinician's own experience and the historical experience of a profession. So one of the things that is most interesting, and I believe is of the most value for those of us who are in Chinese medicine and interested in looking at acupuncture being utilized in different populations, and that is we're able to bring in the historical experience of a profession. And that means, that can mean classical training in acupuncture, it could mean training in 5 elements, it could mean training in Japanese acupuncture. It means that we're really able to bring in different cultures of approach to the treatment of patients using acupuncture or Chinese medicine. So we're really looking at it with evidence-informed practice. We're really looking at being able to look at a much broader and much more inclusive approach to working with patients and including the background in Chinese medicine of the practitioner. So I want to talk a little bit about how it is that patients play a critical role in the EIP model, because they're providing the important information that can form clinical decisions. It varies from person to person, and it has to do with an individual's culture, placement on the planet, the environment that a person lives in. And so taking into consideration the wholeness of patients and how they live in the world, how they define health, is part of our work to be able to look at evidence-informed practice. And that means taking people as individuals and looking at how they interpret the world around them and healthcare. So I am a person who loves jazz. And when I found this little image here of clinical jazz, it was put together by some folks who have been teaching evidence-based medicine and evidence-informed practice for a while. It really spoke to me, because we're taking the patient presentation, we're taking clinical expertise, and we're taking research, and we're blending those up in a balanced way, such as how jazz comes through as a beautiful piece of work. And we're taking these unique strengths and bringing these together so that we are producing something thoughtful and balanced that really represents the true art of healthcare and is geared towards the uniqueness of each individual or groups of populations that we may be working with. So a little bit in summary, and that is that evidence-informed practice considers many types of information when making healthcare decisions, and these include the patient's presentation, their background, their culture, their previous experiences in healthcare. It brings in findings from current research that are methodologically sound, and that means they've been validated and tested through other research. It brings in experience of the clinician's own training and background and the historical experience of a profession. And I'll be returning to that a little bit more and talking about the value of that, the strength and value of that as we move forward in developing more research in acupuncture and Chinese medicine. And then I want to just touch in on the type of evidence has its unique strengths and weaknesses. So when we start to look at outcomes from studies or what it is that we're gathering, some of it is strong, some of it is weak, but we have to learn to evaluate all types of evidence that is being collected. And working with our own bias towards the fact that for those of us who are in Chinese medicine, we've been especially interested in producing evidence and, quote, truth. Sometimes we use the word truths and proof, questionable terms, but we really want others, we want patients, we want practitioners, we want our colleagues in Western medicine to be able to understand the value of acupuncture. And so sometimes we move forward with that with the bias, and part of our maturation, I think, in the world of research is to also be willing to look at weaknesses as well as strengths. You know, what serves us, what can we build on, what can we duplicate and put forward for additional research, and really enter into a critical thinking process that has to do with looking at evidence-informed practice. Okay, so again, just to sort of summarize some of this, it's evidence-informed practice is looked at as a conscientious, explicit and judicious use of current best evidence. It's coupled with the practitioner's experience, and it includes the patient's experience and values. And it's very difficult to even think of terms of, is this a third that equals a whole? This is a living experience. Evidence-informed practice is alive and it's dynamic, and so the balance of these three factors can change and move within any type of inquiry or data gathering or research. Okay, so here's some things that we know, but I still want to touch on them as we move forward, and that is that we know that acupuncture has grown in the past 20 years. And increasing at the rate of research into conventional medicine, it's exponentially growing. And over this period of time, there have been over 13,000 studies conducted in 60 countries, including hundreds of meta-analyses, summarizing results of thousands of human and animal studies. I will give you some references on that towards the end of the talk. And a wide variety of clinical areas have been studied. Currently, we're much in conversation around treatment for pain and opioid management, cancer, pregnancy, stroke, mood disorders, sleep disorders, and inflammation. So there's lots of growing evidence for the effectiveness, evidence-based acupuncture. I want to highlight the Evidence-Based Acupuncture Project. And for those of you who may be new to the world of acupuncture and Chinese medicine, this is a very important resource for you to know about. I'm pulling quite a bit of information from that today. What do I want to say? A serious student of the Evidence-Based Acupuncture Project, and happy to be a part of that. And attended their first conference in Rhode Island a few months back, and there's some really innovative and exciting conversations coming out of the Evidence-Based Acupuncture Project. I encourage you to go to their site and take a look at part of what they're doing, partly because they're a community-run project that's really pulling from the research that's going on in the field. And I find it to be trustworthy, robust, and a set of tools that can help to empower this profession and acupuncture going forward, and help the profession to really engage on an equal basis and make a true improvement and impact on public health, and thus saving lives and providing options to healthcare. So please check that out. And as you go there, check out some of the great resources that they have posted there for you, because they're there for you to use, whether it be to write papers, to look at designing research, or just to deepen your relationship with some of maybe your Western trained colleagues out in the field. So I want to summarize a little bit of acupuncture evidence here, and that is that there have been nearly 1,000 systematic reviews of acupuncture, and the entire literature base was summarized in 2010 by the Australian Department of Veteran Affairs. Well, this was updated in 2014 by two of our colleagues who are part of the U.S. Department of Veteran Affairs, and then again in 2017 by John McDonald and Stephen Jantz, the authors of the Acupuncture Evidence Project. Check it out. It's on the website. Well, so here's part of what they found, and that is that they reviewed the effectiveness of acupuncture for 122 treatments over 14 clinical areas. And McDonald and Jantz found some evidence of effect of over 117 conditions. And to quote John McDonald, our study found evidence for the effectiveness of acupuncture for 117 conditions, with stronger evidence for acupuncture's effectiveness for some conditions more than others. So it's been found to be considered safe in the hands of well-trained practitioners, and has been found to be cost-effective for a good many conditions. So you can go to that and utilize that for your own project development or thoughtfulness towards thinking around how it is in your own practice that you can be able to start to bring the evidence into your promotion. Okay. So acupuncture seemed to have moderate to strong evidence of effectiveness in the treatment of 46 conditions and considered safe in the hands of trained practitioners. And again, having this information and being able to understand what trained practitioners actually means within the profession is an important piece of information for us to be able to discuss out in the larger world of healthcare. I've included this this reference for you to go to Evidence-Based Acupuncture, in order to really take a look at the broad and ever-advancing and increasing numbers of resources that they actually provide for our profession. Okay, so we're going to segue a little bit here. We've got about a third of our time left, and I'm going to talk about a project I've been involved in now for the last 3 years, titled The Mixed Method Study Investigating Health Coaching and Acupuncture and Fall Prevention in Older Adults. It brought together ACTCM and California Institute of Integral Studies, the college that we merged with almost 3 years ago. Involved in this project was one of our licensed acupuncturists, Tara Spalti, one of our students at the time, Alice Liu, and now it's brought in Michelle Lau as one of the research analysts and data developers for the project. Okay, so the Balance Project was basically designed to address the following. Falls among older adults are one of the most preventable causes of injuries, disabilities, and loss of independence. So the aim of our project, the goal of that was to see if we could reduce risks and rate of falling, increase balance, confidence, social participation, engagement, and a reduction in pain and improved sleep quality with a senior population. The project evaluated the combined approach of health coaching and acupuncture together as a means of preventing falls, managing pain, and enhancing health and well-being for older adults who are at a risk for falling. The study evaluated what we might call real-world acupuncture in a community-style setting, thereby allowing us to increase external validity and contribute to future acupuncture research. The feasibility study allowed for collection of preliminary data to establish the key design features for a full-scale evaluation. So the project itself was situated at the Edith Witt Residence, which is a senior community residence located here in San Francisco at 10th and Mission Street in San Francisco. The study consisted of a combination of health coach and acupuncture as part of an important shift towards providing accessible preventive services for seniors living with lower income and lower income housing. And the project was launched October in 2016 and will be completing the data analysis in February of 2019. Okay, so this was a methods. This was a randomized controlled pilot trial conducted to investigate the combination of health coaching and acupuncture for fall prevention, pain management, and associated stressors. The research participants were randomly assigned to one of three arms of the study. The Balance Project enrolled and retained 44 participants for each arm. The age range of the participants was 65 to 70 to 80, so we were coming in at an average of about 74 years old. So it consisted of three arms: health coaching and acupuncture, acupuncture only, and the control group, no health coaching or acupuncture at all. The acupuncture was delivered in a group setting in a comfortable lounge on the 11th floor of the residence at 9th and Mission Street in San Francisco, and it took place weekly for a period of 32 weeks, 2 different phases, 16 weeks each. So the design investigated possible cause and effect relationships by exposing and comparing 3 experimental groups to 1 or more treatment conditions for comparative efficacy. This was a mixed methods design that was inclusive of baseline, mid, and post-testing, and we used validated questionnaires, measurement scales, and indices. Data collection points at the onset of the study and measurements were taken at phases 16 and 32 weeks. And then we had focus groups that were conducted at the end of each of the 2 phases. The image that you'll see here on the right is individuals taking place in the focus groups. And please excuse me, I've included a couple of Shutterstock photos, partly because the acupuncture groups were somewhat shy about being photographed while they were in treatment. So I've included some images here because it did take place in group, but these are not images that actually came from the study. So the senior community at Edith Witt is traditionally a very close-knit resident with long-term relationships among both the residents and staff. The majority of the population at Edith Witt is Chinese, and they are of Thai-Chinese dialect. And residents and study participants included the diversity of folks that make up the San Francisco Bay Area, inclusive of Asian, Latino, Middle Eastern, African American, white, Native, Hawaiian, and Pacific Islander populations. Very diverse community. So for many of the study participants, they knew acupuncture is a familiar approach for treating chronic pain. At the average age of 74, many of these individuals had acupuncture early in life and then maybe later on for work-related conditions. So for a good many of them, it was a pretty familiar approach to getting help with pain. At the onset of the study, the majority of research participants reported daily pain, and that was in our pre-test booklet surveys from the very beginning of the project. But at week 16 of the study, we found that 65% of participants indicated a reduction in pain levels as indicated through the Wong-Baker FACES pain-related scale, and we pulled this information from weekly charting in response to the acupuncture treatment. As I said earlier, the data analysis is under review, and we should be able to put forward a much clearer picture and statistics and outcomes from the study by February. But this was just a bit of insight early on in the study to let us know that indeed folks who were receiving weekly treatment were indicating that they were experiencing less pain in the program. And then I want to talk a little bit about the unexpected, something that came about that we were caught off guard by. We learned a lot very quickly about it. But at week 15 of the study, acupuncture participants, and there was about half of them, began to report that they feared that the acupuncture was becoming addictive. And they stopped coming. And we didn't see them, and we wondered what the heck was going on. So we touched in with the leader of the study participant group. All 3 of the groups had sort of natural leaders who sort of spoke for the group. And what we discovered is that the pain that was actually subsiding for several days made the participants happy, but when it returned, they began to interpret this as an addiction, and perhaps it wasn't a good thing. So we had to think a little bit on how to address this unexpected information, because even though we were happy to see that the pain was reduced, the fact of the matter is, with this aging group of people, and most of their pain had to do with arthritis, old injuries, joint pains and such, it was difficult to have acupuncture once a week and be able to keep the pain at a lower level. We also found that this group of participants were the group that had not yet engaged in the health coaching groups that focused on movement and reduction of pain along with the acupuncture. So this was good information for us. We were hoping to find that using the health coaching, the movement groups, and the acupuncture together would provide more insight into the combined therapies, giving people more access to relief. But we weren't expecting the fact that folks were concerned about the fact that maybe they were becoming addicted to acupuncture. So we began another round of education, talking about acupuncture being a cumulative and other factors that people could bring into the study just in their day-to-day activities in life that could help the acupuncture to be more effective. And we found that culturally sensitive education was really key to being able to help this aging group of folks understand how acupuncture and movement exercise was really the most advantageous for them to be able to have the most benefit to treatment. And once we had addressed that, people began to return for the acupuncture and seemed to let go of some of that fear factor that had prevented them from participating. So a few things that we've learned thus far, and some of those have to do with adequate language interpretation is key. And thinking in terms of culturally specific and dialect related language assistance. We had one of our volunteers, an ACTCM student, did quite a bit of the interpretation for us because her family language, her language of origin was Taishanese, and she did a beautiful job, partly because of her understanding of Chinese medicine, but it became deeper than that. And so helping the participants to understand, to respond to their questions and frequent questions, and helping to develop educational resources for them that were culturally appropriate was one of the things that we learned a lot about, and how to go about developing that for future studies. We also learned that interpretation of acupuncture response to treatment was relative, and part of it had to do with the fact that we were working with a group of seniors who really prided themselves on being strong and not talking about pain. And so how to discuss response to acupuncture without giving someone a perspective that they were older and lacking in strength had to do with, again, asking people questions that had to do with oftentimes daily activities, how they were to engage in daily activities, and then thinking in terms of the serious consequences of falls with this population. It seemed really important to include the fact that goals had to do with not only not falling, but being able to live at this independent residential setting for a long period of time, as opposed to becoming ill, potentially falling, becoming less balanced in life, and then becoming a burden on one's family. And so to sort of pull these 3 points together, one of the things that we learned was more time needed to be spent than we had actually the 3 months prior to that we'd given ourselves to better understand the cultural interpretation of health and expressions of pain and improvements than we were aware of. So I want to talk a little bit about just some gratitude towards the folks from ACTCM that were a part of the project. And one of those had to do with Tara Spalti, again, who was doing some of her DAOM hours there at that point as the licensed acupuncturist. Alice Liu, who did quite a bit of the interpretation and helped us to develop a culture of friendliness and inclusiveness at the setting. And Rick Harvey, our colleague from SF State, who helped us to develop tools to begin to analyze the data that we collected, and Michelle Lau, who has done the greatest amount of work and really shouldered taking the data and putting it into Excel and moving it into SPSS. And I also want to thank the development team at CIIS, Charles, Sarah, and Jillian, for their ongoing support for this project, and hoping that down the road we will be able to do another project of this nature. Okay, I've included some references here that had to do with our design for the Balance project. Please go ahead and check those out. There's some really great stuff out there that has to do with chronic pain management and alternative medicine. Peter Wayne, I just wanted to acknowledge him, his work, the research that he did on the impact of Tai Chi on cognitive performance in older adults. And so taking a look at this was part of our evidence, the evidence that we drew from in order to develop our design for this project. I want to thank you for that, and I think our time has come to an end, and we have time for a couple of questions, Hannah, before we say our adieus.
Great. Thank you so much, Carla. That was so interesting. The one nugget that you had said throughout the presentation about the different responses of people in acupuncture, believing that there was an addiction to acupuncture from that, from their experiences and from their physical sensations. So that was really interesting. Do you have any ideas on what you might be doing for future research?
Yeah, we're in conversation with Charles and Sarah and Jillian, the development team at CIIS, right now, looking at our next phase and hoping that we'll be able to continue to work with the Al-Anon Foundation. We're looking at what programs at CIIS we might be able to bring in as partners. I will add one little thing, and that is the health coaching that we included along with the acupuncture. We found, in order to be more culturally specific, that we needed to modify some of those physical activities and into utilizing very simple Tai Chi or Qigong movements. And the reason for that is because that was the form of exercise that the majority of the residents were most familiar with who came into part of the study. They were easy, people could stay balanced while they did them, but it also pulled on, again, some of Peter Wayne's research, but there were exercises that we had utilized early on that were just too, they just couldn't be identified as a healthy or happy way to exercise. Yoga was not popular at all. Breathing exercises were only appropriate if there was a movement involved, and so we just kept changing those into something until people started to do them on their own. That was kind of the ending point is that a group of about 12 of the participants began to meet outside of the classes that were happening once a week and just do them in the morning on their own. So there was an ownership there that happened that made us that helped us. It showed that evidence, that gave us some evidence that people were able to take in some of the things that we were teaching and then utilize them once we were gone.
We have one comment from a current student, actually. Thank you for your presentation. It was very informative. Hello, and see you in a few weeks. Thank you very much. All right, everyone. Thanks again, Carla. Thank you to everyone who attended, and have a great rest of your day.